Hi, I'm Seth Wolk. I'm the Chief Medical Officer for Spectrum Health System. I'm also the President of Spectrum Health Medical Group. I'm here with Jillian Veeneman. Jillian is an advanced practice provider who's an integral part of the Spectrum Health high-risk breast cancer program. Thanks for coming in and talking with me today.
My pleasure.
Tell us a little bit about this program. What is it? Why is it important? What makes it unique?
Sure. We are very proud of the high-risk breast program. It was started in 2014 by Dr. Melinda Miller, and it has just exponentially grown since then. We've quadrupled in size, really, with the amount of patients that we see. So you can really see the need within the communities that we serve for a program like this. It is a program that identifies women that are at high risk for developing breast cancer, either because of their own personal or familial risk factors. And once they are identified, working with them at a higher surveillance level so that we can detect breast cancer at its earliest stage and, hopefully save lives.
If I'm say a primary care physician, how do I identify a patient that might derive value from this program?
Essentially, if the question crosses their mind that this patient may be high risk, they should send them on over, because a lot of what we do at the clinic is a comprehensive risk assessment program to determine if a woman is at high risk. And so I would say if they are seeing a patient who has a family history of breast cancer, particularly a first-degree relative, mothers, sisters, but also grandparents, aunts, uncles, or any male relative. If they have that family history, then they should be evaluated.
Even males?
Especially males, yes.
Jillian, after a referral is made to your program, tell us a little bit about what happens to the typical patient.
Sure. We get a referral, and the goal then is we perform a comprehensive risk assessment on that patient, which has one of two outcomes. Either we identify that they are in fact high risk and we encourage them to participate in our surveillance program, which again means clinical breast exams every 6 months along with additional screening imaging. Or we identify that they are not high risk, which has its own merit. It certainly alleviates unnecessary fear and anxiety they may have about what their chance of developing breast cancer is. For either patient, high risk or not, we work in tandem with the cancer genetics program to identify whether or not any genetic testing is warranted. If not for the patient, we also look at whether or not it's warranted for any of their family members, so that if they are not the most appropriate candidate for testing, they can communicate to their family member that they should be tested. And that's for a number of genes, not just for the ones people are most familiar with, like BRCA1 and 2, but there's a number of things we look at with genetics. The other thing that we do for every patient is educate them, particularly on the controllable risk factors like diet, exercise, smoking cessation, all the things that they can do to alter their own risk level, in addition to what we're looking at when we do their risk assessment.
Jillian, you must see a lot of individuals, and some of them you must remember well. Do you have a story, something representative of the work you do?
I do. There's one woman who will always stick with me. I think she's very exemplary of why we do more for these high-risk patients than just an annual mammogram. She was referred to us by her primary care physician, and when a patient is referred to us, the initial step is for us to send them a very lengthy questionnaire. It gets into all of their family history, their personal risk factors, for breast cancer, those kind of things. And she filled that out right away, but then waited to schedule her appointment and waited. And so we reached out to her. We had identified that she was in fact high risk from her questionnaire, and so we reached out to her to see if she was interested in scheduling that appointment. And in talking with her, she made it clear that she was skeptical about whether or not she needed to see us because she had just had a normal mammogram. And so my staff really encouraged her to still come to at least get the education about, why our program might be beneficial for her. And we really encouraged her to come in. And so she did. And when I saw her, we had a great visit, a great talk. Again, she was very skeptical about whether or not she needed anything beyond a regular mammogram. And then I did her clinical breast exam, and we found a lump. And that lump, unfortunately, ended up being early stage breast cancer. Had she not come in, it obviously would have been discovered somewhere down the line, but at what stage, we can't begin to predict. And so I think it just shows that, again, for high-risk patients, an annual mammogram is not enough. We need to do more. There has to be more surveillance. There has to be more that we do for early detection, because now she's doing great and she is cancer-free. And I'm thankful every day that we really reached out to her and had her come in.
That's quite a story.
Yeah.
Jillian, when you're not running this program, what do you like to do to relax when you're not at work? What's your ideal weekend?
Well, I'm a busy mom. I just had a baby 10 weeks ago, so right now I kind of forget what hobbies look like. But we're a big outdoorsy family. My husband has numerous hobbies, all of them being outdoors, and so we like to do a lot of weekend adventuring. And the biggest adventure, I think, for us is that we just signed up for the Bayshore Half Marathon in Traverse City over Memorial Day weekend. So that's going to be the biggest thing for us. It's a definite challenge while working and raising two crazy kids, but that's the next thing.
I want to thank you for taking the time
My pleasure.
to talk to me and describe what really is a fabulous program. It certainly brings tremendous value to this organization, more importantly to the patients we serve in the community. Thank you for coming in today.
Yeah, thank you.